with Dr. Ashma Sharma. She is a psychiatrist for adolescents. So do you want to give a brief description of your job?
Yeah. As you said, I'm a psychiatrist, but I specialize in kids. So that's the population I generally focus on. And I work in a community mental health clinic, basically treating kids and young as 5 years, and then teenagers, and then I also see adults.
So why did you choose to pursue this field?
Well, I think I've always been fascinated with how the human mind works. I started off being a physician, and then I was going to do pediatrics, but then I switched to psych because I thought it was way more interesting than just. I don't want to put down, pediatrician's job, but I felt like there was more need for, for people who can work with kids who have mental health issues, because that is what I was still trying to help kids with, those problems, even when I was doing my pediatric rotation. So I felt, well, why don't I specialize in this field? Because that fascinates me, and that's where I felt I could be of. I guess that was my passion. I just like psych and how the brain works, and that part of the medicine, I think, is still unconquered. There is a lot to know. So I feel like every time there is more new things coming up, and so that's why I feel it's more exciting to be in this field. There's still a whole lot we don't know about it. So every time, so there's more to look forward to, I guess.
Yeah, and like you said before too, it's very interesting, but also there's a lot of stigma towards it too, right? There's people who there's people who don't choose to, acknowledge it the same way as others do.
Yeah.
So
of stigma, yeah, that's I think that's something which is interesting, because it's not just that you think it's the general public who struggles with it. I've had even physicians, sometimes even they don't realize that. So the stigma is pretty deep, and you notice it in the social level, and then the social level, I guess you can say, is generally because there is lack of awareness. The people really do not know what mental health is, mental illnesses are. A lot of people get their so-called education from media, movies, and they don't really depict a mental health as it is. They try to dramatize it, and it's more sensational. So it's always, when you think of somebody with mental health issues, generally the thought that comes to your mind is it's more of, either they call it crazy people or violence, or, and that's not what mental illness is. It's very different than that. So when people start to think of it that way, it affects people who have mental health illness. And especially sometimes there is a stigma in the person who has mental health illness, right? Because they feel like, this is something that they can fight. They don't see mental health, mental diseases as a disease. They see as something that they can overcome. If they were just strong enough, or, they can just do something about it, which is really not the truth.
Yeah. So
there's a lot of prejudice.
Yeah. So how do you see that? Oh, sorry.
Go on.
How do you see that stigma affecting your patients personally?
Well, it's really, I would say I have to constantly deal with that, because a lot of time, because, I see kids. So naturally, when the kids are still not at a legal age to consent for treatment, so I have to obtain consent from the parents. So sometimes they'll come to see me, and even by the time they reach me, they have gone through several hurdles. they've gone through, there's probably they get referred to the pediatrician, they might have seen the counselor at school, and then they are seeing a therapist. In the agency where I work, most of the kids who come to see me, they all have a therapist. So so they've been kind of they've gone through some psychoeducation about this is what the illness is. In spite of that, I still struggle with the stigma, because sometimes the parents don't believe that there is a mental illness. They think, oh, she just has to be strong, or maybe if she will start sleeping better or start eating better, something like that. And then sometimes it's the kids, because they don't want to be labeled, right? It's to be labeled with a mental health issue is for them, it causes feeling of shame, and it affects their self-image, and they don't want the kids or their friends or everybody else to see them a certain way. So what it does is, sometimes they don't even reach me, right, for treatment, because all this prejudice or the stigma makes them feel like, you don't need to, you'll get better. So the treatment is delayed, and then that can cause complications, that prolongs the illness, that causes bad outcomes, something that you don't want, and it really makes a huge difference. If you get help sooner, the treatment is more effective, and you get better sooner too.
Yeah.
So that's one of the thing. I mean, it affects, the stigma just doesn't affect the treatment. It affects really a person who has mental health issues. It affects their whole life in a way, right? Because if somebody is thinking, oh, I have this mental health issues, they don't want to talk to their friends because they are afraid how they will perceive them. If they are if they're adults, they don't want to tell their co-workers, because they're concerned it'll affect how they will see them, or they will miss out on opportunities for work. Maybe they will not get promotions. It really affects all spheres of their life. Sometimes they are afraid they may not even get good housing, because why? Because people perceive mentally ill people to be violent, right? That's what media promotes. So sometimes they have difficulty getting housing. So the basic needs, that gets affected. So it's not just the treatment, it's their whole life. And then talking about, your age kids, because, that's what I'm sure you're interested about. It'll affect, they are concerned that might be the reason for bullying or harassment at school, if kids find out, and that happens all the time, so for fear of that, they will not, they are silently suffering for a really long time. And then the way they think about themselves, constantly their self-esteem is being affected. They start to doubt themselves. They feel like they're never going to achieve what they want in life, right? So it is a big thing. The stigma is a big thing, and it's not just limited to how it's affecting their ability to seek treatment and get help, but beyond that. So what you guys are trying to do by trying to promote this, because that's the way to fight it, right? To bring about awareness, and whatever little anybody does, it goes a long way. So that's really good.
Yeah, thanks. So for the patients that you see and they carry like these stigmas or the beliefs that you were talking about, what kind of what do you tell them to kind of sway their thoughts from enforcing that stigma? Like, what would you say to them?
Well, same thing. Educate yourself. Educate. Learn more about it. Don't be afraid. First of all, when that starts to happen, don't shy away from getting help. So there are so many support groups. There's a National Alliance on Mental Illness, NAMI. That's what it's called. You can join those groups. The family, the the kid who's going through any mental health issues, and they'll educate you and they provide you with resources and stuff like that. So I think that's what you do. You, in order to get over the stigma, you have to face it like any other fears, right? And you start with knowing more about why are people so afraid of mentally ill people. I mean, they are still people, and mental diseases are a disease of the brain. I mean, it's and brain is part of your body. So so it is a medical problem. So you can't just treat it like anything else. So and you start with knowing more about it. So that's what you get help, reach out, don't isolate yourself, and don't equate yourself with the illness. You are not what the illness is. So I think that's important.
Yeah. So I feel like what I see a lot here, at least in our community, is people kind of don't know the difference or where the line is between feeling sad or actually having a mental illness. So when do you feel that someone should come and talk to a therapist?
Well, that's a very good question, because, right, we don't really know what is concerning, because partly the stigmas are playing their part, right? Because we start to feel like, oh yeah, he's just down because he just had a bad day or something. But I think what you have to look for is a consistent change in a kid's presentation. Now that could be, if you start to notice, like, what are kids supposed to do? What is their job? Their job is to go to school, right? So you start to look at that. If they start to go off from their track, like if somebody was a straight A student and suddenly his grades or her grades starts to fall, then that's a sign. Like, unless there is a specific reason, then you start to look like, okay, what's going on? Why this kid used to be really good, and now look at him, he struggles. He can't even, he's not even attending classes regularly. So, their school attendance starts to get affected. So they don't want to go to school. And they start to notice that their behavior might be changing. Like before, they were very social, and now suddenly they don't want to be with friends. Or, they're coming up with excuses of this or that, just because they're wanting to isolate. So change in their functioning, change in their behavior, and you start to notice their mood. And that will be once in a while. We are human, we all have our ups and downs. But if consistently you're noticing there is irritability or anger, or there's an oddness to your behavior, something out of the norm, you have to pay attention to that. Like we listen to our body when we start to have an earache, we straight away go to the pediatrician and have it looked at. We have to hear our body. We have to pay attention to it. So if we start to notice that our moods are changing, other thing, our sleep. If our sleep start to change, and it's once in a while, yeah, you have a test coming up and you're anxious about that, that's understandable. But if every night you're having difficulty with sleeping, or you are not getting enough sleep, you are tired all the time, or your appetite is changing, and your motivation to do things, you just get bored easily, or you started to notice you're more anxious than normal. You're like, always living on edge. So normally what happens is a lot of time people do not recognize sadness, anxiety. They are not very clear about that, how it presents. So a lot of people present with somatic complaints. They'll be having more aches and pains. They are constantly having stomach ache, or they're constantly having headaches. So that's again, so it's your body telling you, because we don't want to recognize that we are having issues, so we just kind of internalizing everything. The other thing will be, people say who are struggling from depression, they start to be very negative. They start to focus on negative things, thoughts about death and suicide, and just negative stuff. And if somebody is a good student and suddenly just indulging in reckless behavior, then you need to pay attention, right? Because what is it? Out of the norm. That's what you're looking for. Anything which is which a person is used to, and you start to notice a different in their behavior or functioning or presentation, consistently they're acting like that, then that's a red flag. You need to pay attention, right? Substance use, that's a red flag. So these are some of the examples that you may want to look at. Yeah. The important thing is not to ignore when you start to notice these things. Seek help.
Mm-hmm. So as a friend, and you notice these warning signs in
Mm-hmm.
your other friends, what
Mm-hmm.
do you have any suggestions what that person should do? How can they help?
Mm-hmm. Yeah, I think friends, having friends is helps you mentally. It's a very, very important thing, to be social. But then also, sometimes I've noticed that kids do not feel comfortable talking to their parents when they start to feel like that. But they'll confide in their best friend, and that is very good. That is very nice. But as a friend, I think what's important is you need to understand that you cannot take the responsibility of being their clinician, being their doctor. So be there, listen to them, but what your job will be to get them the right help, persuade them to get the right help. And like, so for example, I don't expect a friend to know, now where do I go? It's easy for you to say, get the right help. How do I get it? Well, most of the schools have.
Sorry, I'll cut that part off.
Yeah, is the doggy gone now?
Yeah.
Okay. So most of the schools have counselor, right? So, or you don't even have to have a counselor. Talk to the teacher, talk to the adults in your life. So, but again, it's easier to talk to the teacher or to the counselor, and then they know what to do. I mean, most of my referrals, most of the kids that I see are really getting referred from school. It's amazing. Like, very few I have who parents bring them. Most of the time, the kid has confided in their friend, and then the friend took a really positive step, and then he or she spoke with the counselor or the teacher, and then they got the ball rolling, and they finally come to us. So that's it's one is that way. The other is, when kids go for their physicals, your pediatrician normally asks you, how are you doing, right? So when they're asking you that question, it's not just physical health. They're kind of supposed to be the gatekeepers and trying to look for your overall health. So you have to be comfortable letting your doctor know, hey, doctor, I haven't been feeling too good recently. I just feel so down, and whatever. Then the doctor knows, okay, I guess you need some specialized care, and we'll refer you to see a psychiatrist. So that's where you seek help. So basically, any responsible adult, it is either it's through your best friend or the person who's suffering, talk directly to the counselor or the teachers or the pediatrician, and the best, your parents, if you are able to communicate with them openly, which I hope.
So here it's very common that children are kind of afraid to go to a doctor or their counselor because they feel like it will somehow reach their parents. I've had like a lot of friends who refuse to reach out for help because it's like that fear, like my parents can't find out. So like, what method do you think they should use, if any, at our age, like under 18, without kind of going through the parents?
Well, end of the day, parents are going to find out, right? Because teens are still teens. They are still not at a legal age to consent for treatment. So the parents will have to be involved. And my suggestion is that, like, they are scared of what's going on with them. Parents are too. They are also struggling with the stigma. They don't know about it. But that should not be the reason to not get help. You start the process. They will also learn on the way. So that should not be the fear that parents will find out. Because do you think they will find out and they will stop the treatment if it's going to help their child? Some parents might, but it's a process and you have to start it somewhere, you know? And again, I'm going to go back to the stigma thing. I think the whole public basically learning more about mental health, changing how we see it, that makes people comfortable. And that's another thing, right? Why do you think parents don't want to their kids to get help? Because they feel like, oh, they'll be discriminated, or they will be labelized as crazy, or you know, or something. So, but I think that's why it's important, even for a responsibility of the media, right? They have to also stop sensationalizing this when there's suicide, or when a celebrity does something. So it's all education and making people understand what's going on, so they're comfortable when it comes to their children or their own mental health, that they feel comfortable seeking for help.
Yeah, so that's kind of all the questions I have. So thank you so much for coming and for talking about this.
Good. I thought you wanted to know more about the risks, and do you want to ask about that?
Well, most of our questions were kind of like, my main thing that, like, when we were talking, we were like, we definitely need to target, like, what I asked before, the line between being sad and depression, because like recently, at least, like that's what we were seeing with our friends and stuff, like people asking us, like, how do you know, you know, when
my advice to that is, you are not supposed to know. If you're feeling something, talk to the right person. Let them make a decision. Are you depressed, or is just plain sadness? You don't have to. If you are not feeling good, go seek help. That is what should be the motto. You don't have to know. You're not a psychiatrist. You're not a therapist. You don't need to know. Yeah. So, and I think that's why utilizing the counselor at school, that should come very easily, very, very normally to kids. Because it's really, really important, especially when I'm hearing that they're afraid that their family will find out. Then they need to have an outlet, you know? The sadness, which might be just here and there related to whatever negative thing that has happened in their life, can soon become depression, you know? So it's important not to ignore it. Yeah. And who knows when they start that, because when we see kids, we are not just seeing kids. You never treat just the person. You have to treat the family in order to have a good prognosis, right? So during that process, you know, you never know that you might be able to help them, so that they don't relapse, or the thing doesn't become worse, you know, other complications don't arise. Because it's not just treating that episode or that whatever is going on, it's to make sure that you stay in good mental health. So and the family plays a huge part in that, because that's the micro environment you're living in. So that it's very important how you're living in that, what kind of support you are getting. I mean, if a kid is feeling uncomfortable talking to the people who he lives with on a daily basis, then that's something which needs to be addressed, you know? So yeah.
Okay. Yeah, I'll add that part before I said thank you.
Okay. We can go on. I can talk.
Okay, but yeah, that's like the questions I have.
You have enough 15 minutes?
Yeah, that was long, and it was also very like to the point. So thank you, because I don't have too much to cut out.
Okay.
Thank you.